From diagnosis to treatment and back home in as little as 18 hours. It sounds too good to be true, but it is, and it's happening right here in Toronto.
Brand new ambulatory care center at Women's College Hospital. It's setting new standards for patient care, something they had only dreamed of before. With more on this exciting new program, here's our health reporter, Pauline Chan. Pauline?
Thanks very much, Ken and Michelle. Well, a lot of cancer patients say the waiting is the worst part, but one of the areas where these rapid turnovers are happening is in breast cancer. Diagnostic tests can be done in the morning, and if a cancerous lump is found, you can meet a counselor and surgeon right away. Some patients will want more time to consider their options, but if you choose, surgery can follow in just hours.
I was seeing you today because we were going to talk a little bit about your family history of cancer.
For Leela Goldhar-Waxman, her choice for a double mastectomy came after learning she had a genetic mutation similar to Angelina Jolie.
No lump, no tumor, and no family history. There's no breast or ovarian in my family. So when I got the call, I was shocked.
With the chance of developing breast or ovarian cancer that was 10 times the risk of regular women, the 38-year-old mother chose preemptive surgery.
Right then and there, I knew, having 3 beautiful children in my family, that my health was number one, and whatever I could do to be here for as long as I can was what I was going to do.
She had surgery last August and was home that same night. While Leela's case was a little different in that she discovered her genetic risk through participation in a hospital study, the new ambulatory care center at Women's College Hospital can have patients with cancer go through diagnostics, counseling, surgery, and be released from hospital in as little as 18 hours. And instead of returning to the doctor for a checkup a month later, the patient's recovery is monitored daily using a mobile app. It allows the patient to send back information regarding pain, fluid drainage, and even send photos of the healing. Dr. John Semple says doctors are getting better insight into patients' recovery than ever.
It's a fairly interesting concept because that patient experience of that first 30 days we knew nothing about.
Plus, patients face a lower risk of infection and a greater level of comfort recovering at home.
In healthcare, some of the biggest sort of interventions in terms of cost savings and efficiency are not necessarily putting more MRIs out there in different towns, but this is technology that's actually in people's pocket.
Leela appreciated the speed and convenience of the whole process, adding she's planning to have her ovaries removed at a later date, just like Angelina Jolie. And Dr. Semple says the app is also being adapted for orthopedic cases and geriatric patients with very good response. Out of the 60 patients in their original pilot, not one mobile phone was returned out of dissatisfaction, and there was even one case of infection that they were able to spot very early on through the photos. With today's Lifetime, I'm Pauline Chan.